Hi, this is Shane Hostenske in Adult Health 1. Today I'm going to be going over Module Assignment 5, in which I'm going to talk about the structures and functions of the eye, while also going over some common diseases of the eye and how nurses can manage those diseases. So I'm going to begin with the sclera. So in my diagram here, the sclera is going to be right there. Now, the sclera is the white part of the eye that covers almost the entirety of the eye. It is a supporting wall of the eyeball. The sclera helps maintain eyeball shape and protects it from injury. This surrounds the iris and the muscles of the eye attached to the sclera. Now, moving on, we're going to look at the conjunctiva, which is going to be found right there on the diagram of the eye. The conjunctiva is a thin clear tissue that envelops over the sclera and underneath the eyelids. This structure provides protection and lubrication of the eye by producing mucus and tears. Now moving on, we have the cornea, which in my eye diagram is right there. The cornea is the clear front window part of the eye in which transmits and focuses light into the eye. If corrective laser surgery is done, then the cornea is reshaped, altering the focus. All in all, the cornea helps focus light so one can see clearly. Now, moving on, the anterior chamber, which is found right there in my diagram. Now, the anterior chamber is found between the cornea and the iris. This is filled with a fluid known as aqueous humor. This fluid is produced constantly and contributes to the pressure of the eye. Now, moving on to the next structure, the iris, which is going to be right there. The iris controls the pupil, enabling the eye to see clearly. It is the colored part of the eye. The iris changes depending on the pupil dilation. Which now, moving on to the pupil, it's going to be right there on my diagram. The pupil is what enables light into the eye. In a dark environment, the pupil expands to allow more light in, and in a bright environment, the pupil contracts. Now, moving on to the next structure, the lens. The lens is going to be right there. The lens works together with the cornea to help focus light correctly on the retina. It is able to change shape and bend light to focus images. The lens is held by fibers called zonules. Now, moving on to the next structure, we have the vitreous humor, which is going to be this big part. And that is the biggest part of the eye, 80%. So I'm going to get into that right now. This is the largest structure in the eye, making up 80% of the eye. This is a clear gel that maintains the shape of the eye and also provides a clear space for light to pass through to reach the retina. Now, the retina, which I had just mentioned, is going to be right there on the diagram. The retina is a thin layer of tissue that lines the back of one's eye. The retina contains cells known as photoreceptors that take light and transfer signals to the optic nerve. Now, like I just mentioned, the optic nerve is going to be found right there in my eye diagram. The optic nerve is a bundle of over 1 million fibers that carry visual messages. It takes this information processed in the back layer of the eye to the brain. Now moving on, we have the macula, which is going to be right there on my eye diagram. Now, the macula is located near the center of the retina. It processes sharp, clear, and straight ahead vision. It is where the central vision comes from. And lastly, the structure, the choroid, which is going to be found right there. Give you a closer look of the structure. Now, the choroid is the layer of blood vessels that sit under the retina, providing it with nutrients. Now I'm going to move on to some disease processes of the eye. The first one I want to talk about is macular degeneration. This disease affects the central vision of the eye. This disease damages the macula, which is located in the center of one's retina. This disease is the leading cause of vision loss in people aged 60 and over. Macular degeneration can be wet or dry. Wet MD occurs when abnormal blood vessels grow under the macula and leak fluid and blood, damaging the macula. Dry MD is the thinning of the macula, which blurs central vision over time. Symptoms of macular degeneration are blurred central vision, black or dark spots in center part of field or vision. There is no cure for this disease, but treatment can slow the process. Recent advances have been made in treating wet AMD through intraocular injections of anti-VEGF medications. This is because studies show a lot of VEGF in the eye leads to formation of abnormal blood vessels, which are causing the damage. Now, a nursing diagnosis for macular degeneration would be disturbed sensory perception related to macular degeneration, as evidenced by a distortion of central vision. We as nurses could teach the patient the importance to see an ophthalmologist once a year at least to monitor vision. We as nurses could also ensure we provide adequate lighting for patients to carry out activities. We want to provide lighting that avoids glare and surfaces. We overall want to provide a supportive lifestyle, provide teachings on supportive lifestyle changes to adapt to the loss of vision in the patient. Now moving on to the second disease, a cataract. Now, cataract is the leading cause of blindness in the world. The lens of the eye is normally clear, but over time, the proteins in the lens of your eye begin to break down and clump together, creating a cloudy area on the lens. The cloudy lens, aka cataract, can occur in one or both eyes. This is common in people over age 50, but can occur at any age. Symptoms include cloudy, blurry vision, glare around lights, trouble seeing at night, and need for bright lights to see. Now, there is a surgery to remove and replace the lens with an artificial lens, and this procedure is highly successful with more than 90% of people seeing better after this treatment. Now, the nursing diagnosis for a cataract would be disturbed sensory perception related to cataract as evidenced by cloudy vision. We as nurses would want to assess the patient's ability to see and perform certain activities. We would want to teach them the process of surgery to remove lens and replace lens with artificial lens. We would want to teach them about the recovery time and that people generally begin to see better right away, but sometimes it can take weeks to see improvement after surgery. Now, the last disease process I want to talk about is glaucoma. Glaucoma results from higher than normal fluid pressure in the eye. This pressure in turn damages one's optic nerve, affecting how visual information is transmitted to the brain. Now, like I had shown you before in the diagram, the optic nerve is located right there. This really affects how visual information is transmitted to the brain. This can lead to vision loss in one or both eyes and usually is hereditary. Two types of glaucoma are open-angle glaucoma, which develops over time, and closed-angle glaucoma, which can occur suddenly, being painful and causing vision loss very quickly. Symptoms include eye pressure or pain, headaches, red eyes, rainbow-colored halos, nausea, and vomiting. Treatment for glaucoma include reducing eye pressure with prescription eye drops, laser therapy, and surgery. Now, a nursing diagnosis for glaucoma would be disturbed sensory perception related to glaucoma as evidenced by progressive loss of visual field. Now, we as nurses would want to determine how far the glaucoma has progressed in the patient. After assessment, we would want to teach patient the options for treatment, such as prescription eye drops to relieve pressure and slow the progress of glaucoma. And we would also want to teach about possible laser therapy or surgery in certain cases if the eye drop prescription medication is not effective. And that is all I have for you. Thank you very much.